Has your hair been shedding a lot more lately, or you've noticed it getting thinner as you've aged? You may be experiencing something called telogen effluvium. Now, it's normal for 10% of our hairs to be in the shedding phase, but during telogen effluvium, more than 20% of our hairs go into the shedding phase, and this is typically when people start noticing more hairs in the shower. Telogen effluvium typically happens weeks to months after an inciting event. So let's say you got a fever, 3 months later, you might experience increased hair shedding. Now, there's other conditions that can be linked to telogen effluvium. Here are some of them. Feel free to take a screenshot. And hair thinning as we get older is common. It's called androgenetic alopecia. This is due to genetics and hormones. Now, although telogen effluvium typically stops on its own, it can last months to years if you have the chronic form. There's different medications you can use to promote the hairs to go back into the growth phase and stop the process. One of those medications is minoxidil. It can be applied both topically or taken orally. This is one of the medications we have at EasyDerm, and it's very effective. You can feel free to take our quiz to see if you're a candidate for this medication. And minoxidil is very effective for hair thinning and androgenetic alopecia. Here's one patient who took oral minoxidil and her results after 6 months. Now, topical minoxidil is available over the counter, but if you want a prescription for oral minoxidil, you should visit your doctor, or you can go to EasyDerm.com. There you can find out if you're a candidate for this medication and also learn about the side effects.